After breaking a bone, the body immediately begins a process of healing. When a fracture occurs, blood vessels which supply the bone are damaged, releasing blood into the surrounding area. As this blood begins to clot, a hematoma is formed around the fracture. After about 48 hours, chondrocytes, or cartilage cells, form a fibrocartilaginous matrix between the ends of the broken bone. Additionally, another external callus of hyaline cartilage and bone is formed by the periosteal chondrocytes and osteocytes, surrounding the internal callus. Within these calli, osteogenic cells activate to differentiate into osteoblasts. Through the process known as endochondral ossification, these osteoblasts begin replacing the cartilage of the calli with lamellar bone. This lamellar bone is eventually remodeled into spongy bone and compact bone. The remodeled bone closely resembles the original state of the bone before the fracture. Often, this process leaves a slight swelling at the site of the fracture in the healed bone.